dedicated for you and Tanzania, our Tanzanian friends. Really, I'm very happy. Nice to meet you. I'm trying to use and to learn Chinese miracle.
Oh, really?
Yes.
Yes, you can join me.
Medicine. Yes, you are welcome. Do you speak English?
Yes.
You understand?
Yeah.
Okay, so I will do it in English if you want, because I have a lecture about the contribution of acupuncture for cancer to prevent the side effect of chemotherapy, and it's real pleasure. I try to do a live TikTok. You are TikTok live.
Okay.
Yes, well, welcome. I will present you to my followers. Yes, from Tanzania. You are from China?
From China.
Peking.
Shenzhen.
Shandong. I have been on last August in Peking. It was a very wonderful experience.
So you have
I went-
learned this kind of in China?
Yes. Academy, International Academy of Peking. So I will start if you are welcome. You can take a chair.
Okay, go for
Sit.
it.
No, you are welcome.
He's
So-
still young, so
So in Morocco, cancer is management. Cancer management has evolved significantly and has become more complex in a few years due to development of surgical technique by partial nephrectomy, laparoscopic surgery, but also robotic. There is a robotics that gives more efficiency. For more than a decade, the target therapy has been an evolutionary turning point in the management of metastatic form of cancer. But the more important thing that this technique has a mechanical effect, not a global effect. That's why I learned traditional Chinese medicine, because cancer is increasingly being detected with the preventive medicine, but also to avoid some exposition, some behavior of eating of food, and to take care of our own body. But when the cancer is detected, it needs to do everything possible to take care of the patient with all techniques. We have surgery, we have chemotherapy, we have radiotherapy, we have target and immunotherapy, but we need other things for global, because we have side effects. The problem is there is no global care of our patient with conventional medicine. We need other things. We are thinking about traditional Chinese medicine. If it's possible to try to avoid some side effect and adverse effect of chemotherapy, radiotherapy, immunotherapy, and target therapy, drugs, treatment for cancer with digestive disorder, but also diarrhea, nausea, vomiting, and fatigue that keeps the patient in a bad situation with depression, fever, loss of appetite, and some stomatitis. It is mouth irritation, very painful for the patient, that keeps the difficulty to eat and to be better with food. A drop of red cells, white blood cells, and blood platelets, the dryness and redness of the skin with radiotherapy. The problem is we have some medication that gives some side effects very difficult. Cancer is described since more than the Egyptians, but the thinking of the Chinese traditional Chinese medicine, trying to have a comprehensive approach with globality, with 5 elements. You know that it's the energetic vision to the man connected to the universe, because connected in accordance with the so-called Taoist thought, and is absolutely opposite to the mechanistic vision of the human body, connected by the age of enlightenment. Its history is 1,000 years old, and manuscripts dating back 5,000 years refer to it, and it remained widely practiced throughout the Asian continent. Now this is the 5 elements, because in Chinese, traditional Chinese medicine, we have the effect of the external factor and the internal factor. What's the external factor? It's the wind, cold, hot, and humidity. But also we have internal factor or emotional factor. That's it, joy, anger, sadness, but also some overthinkings, but also fear that keeps the patient in the bad situation with stress, and to give some problem of the loss of immunity. That's the problem with the fear. But also we have some non-external or internal. There is a food, overwork, and surgery. Surgery is the wound. When we are hurt by the surgery, that gives the patient in the bad situation to be very weak. Traditional Chinese medicine describe this situation as an empty of yin or qi, obstruction of the qi with you call it qi, not qi, qi, the energetic circulation, the qi, qi in Chinese language, qi. Qi. They correct me when I call it qi. They correct me with qi. See, the presence of the heat, this keeps the tumor having a solid situation, and humidity and stagnation. This is the traditional Chinese medicine explanation. But also we have some a weakness of the Wei Qi. What's the Wei Qi? It is the protective, length protective, defensive energy that keeps the imbalance between the yin and the yang, and acupuncture can give us some solutions. Right now, there is some evidence that studies review with the systemic effect of acupuncture for numerous conditions, because all studies recognize the effect with the strong evidence and positive effect with acupuncture to the chemotherapy and the nausea and vomiting, but also postoperative nausea and vomiting and postoperative pain with the strong evidence. And there is some studies that published recently in 2018 that acupuncture with retention. We don't need a lot of retention. They did 3 groups. One group with 2 minutes retention of the needle on the skin, 10 minutes and 20 minutes. They found there is a good effect and without differences between the group. It's not important the duration. The best thing is to do acupuncture, 2 minutes, 10 minutes and 20 minutes. And that gives the avoidance of anxiety, depression, stress, to have a decrease in fatigue and improved quality of life. With a minimal duration of needles, that's, thank you, that's recommend some person to do acupuncture, or person doing acupuncture to recommend to their closer family and friends in 95%. There is another article that shows that acupuncture is recommended by the practice of the American Society of Clinical Oncology guideline of chronic pain in adults, cancer survivor. Recent randomized clinical trial of acupuncture have demonstrated favorable benefits in reducing chronic pain related to the chemotherapy, hormonotherapy, radiotherapy, and surgery. Oncology acupuncture is a new specialty of supportive care in oncology. That's the newest thing is to advise and doctors to do a specialty in oncology acupuncture. In 2012, there is a symposium. It was a symposium in 2018 in Baltimore, in Australia. The symposium, that's the main of the focus, is to evaluate the effectiveness of acupuncture for the cancers in a lot of countries, like in United States, in the UK, Australia, in Europe, with strong evidence. That gives some idea for the organizer of this symposium, because there is an access to effectiveness of acupuncture for cancer in geographic regions, including Australia, Canada, United States, and European Union, were actively responding to cancer survivor demand for the care, and presented highlighted the rates of use of well and well-being to use acupuncture. You see on the screen that increase the use, but there is some financial barrier with the cost of acupuncture. But there will be a remarkable perspective with this kind of acupuncture. I will show you, sorry. There is another article published on JAMA Oncology in 2020 that explains clinical practice guideline acupuncture treatment of patients with moderate and severe pain cancer for the acupuncture for the treatment of the cancer pain. The recommendations were developed towards the Delphi Consensus International Multidisciplinary Panel, including 13 Western medicine oncologists, clinical practitioners of Chinese medicine, and 2 patient representatives, certainly of evidence, patient reference, and value resource of other factors were fully considered when making recommendation. The recommendation and the results of the guideline proposed 3 recommendations: a strong recommendation in favor of acupuncture treatment rather than no treatment, a drug in the class of aromatase inhibitor authorized for the treatment of the breast cancer after surgery, as well as against metastatic in women before or after menopause. Donc, acupuncture is very effective for this kind of person with strong evidence. There was another article published in 2021 that gives some beneficial effect of acupuncture and electroacupuncture. This is electroacupuncture when we stimulate the needles with some small electricity that gives beneficial effects on fatigue, on insomnia, nausea, vomiting, and pain, but also xerostomia and anxiety, with less depression, and encourage the doctors to use with widespread adoption in clinical application. There is I think 2023 article published that explained that acupuncture is effective for the use in hematologic and malignancy hematopoietic cells transplantation, with strong evidence to reduce the pain and the nausea vomiting, but less strong for peripheral neuropathy, fatigue, constipation, insomnia, night sweats, and pruritus. This is very important for some article published in 2022 that explain that the theory of acupuncture in oncology by a meta-analysis and randomized trial for the American Society of Cancer, through the analysis of 4,590 articles, and they included 65 articles with a strong evidence that showed that the current review indicates that acupuncture is safe as the same acupuncture and active control. In oncology patients, the author recommends that researchers consider the CONSORT conciliation standard reporting trial with safety and harm extension for reporting the capture side effects and better investigate the risk profile of acupuncture in oncology. There is another article that proved the efficiency of acupuncture in oncology, in gynecological oncology children. That they try to choose 3 groups. One group with acupressure and relaxation. You know that acupuncture is the massing the acupuncture point with the relaxation in preoperative, but also the using of acupuncture through the intervention, the surgery. But also another group with only acupressure and the relaxation in preoperative. The third group is without anything. They prove that there is the best quality recovery when we use acupuncture. The best group is when we use acupuncture since and through the surgery. That's very effective and good news. There is a last article published in 2024 that tried to use acupuncture as an integrative therapy, was used in context of oncology and based on strong evidence, but there is some barrier for implementation in conventional medical clinics. Although acupuncture is recommended in oncology clinical practice guideline, there is limited data in the literature showing how acupuncture and other related therapy, including herbal medicine, and while others face barrier to care, to characterize the current use of acupuncture and herbal medicine in oncology clinic. So we collected some data and the utilization of 5 clinic examples in addition to better understanding the barrier faced by acupuncture in implementation to treat modality. There is this study showed that there is strong evidence, but there is some barrier of the cost, the competence of the acupuncturists, but they need also training. The problem is accessibility, the availability of acupuncturists, but also the cost of the training. But there is some question about safety of herbal medicine during the treatment. There is another paper published in supportive care in cancer when they use acupuncture, and they found first recommendation, international recommendation with multidisciplinary evaluation of the oncologist and the acupuncturist to practice very safe kind of acupuncture in oncology integrated. The problem of the chemotherapy is the fatigue, and the fatigue is to treat, all oncologists have the problem to treat this kind of fatigue. But there is some studies published that show that there is a loss of coenzyme Q10 to explain the loss, the decrease of coenzyme Q10 to explain the fatigue. With some explanation, there is a problem in mitochondrial dysfunction that can be treated by acupuncture. The problem in this case of cancer, in this case, traditional Chinese medicine certainly doesn't claim to be a substitute for cancer treatment, for which there are current no effective substitute, rather in a constant dialogue with the oncologist and the patient. It is a question of supporting without harming him the work of classical therapy. And more than the Chinese pharmacopoeia, it's another very old branch of supportive therapy treatment. Acupuncture can, with benefits and depending on the patient's condition, be coupled with dietary program, but also with physical activity or even psychological care to have good effects to treat this kind of patient. But there is a role of the doctor acupuncturist. Acupuncturists need to be a doctor to understand and to explain better all things about cancer, but also about acupuncture. The first consultation is very important to know which kind of type of cancer, to know the protocol. The protocol is important because there is some drugs that keep some side effects. So we need to know which kind of protocol, how molecules works, and to know effectively the side effects that we will have to fight. What's the role of acupuncturist? Acupuncturist has synergic help with the oncologist. He needs to help to give the full dose of chemotherapy. That is very important. When the patient supports the full dose, the effect is more effective. The role of acupuncturist is a psychological role, not substitute role. But the future is being able to mitigate the side effect that still elude us to restore the quality of life. What are we doing in our clinic, in our hospital daily? We take a picture of the ears of the patient, then we try to do auriculotherapy, and at the end we take off the needles and we replace them by a kind of tapes. You know, like here, it's a tape with a very small needle of 0.6 with the ball behind to stimulate. I show you. It's not painful. It's like acupuncture with the. So we do it on the ears, like I did in my lobula. Donc so before starting the chemotherapy, we do it 48 hours before. So we use also electroacupuncture. The electroacupuncture is very effective. The day of the chemotherapy or radiotherapy or surgery, when we have some treatments with the surgery for the patients, we use acupuncture before the surgery. That's it, very effective. And sometimes we use moxibustion. Do you know what moxibustion? There is these plants dried and burnt that keeps warm and hot, that keeps the effectiveness, but also that gives the effect of the point around the acupuncture point. For the babies, the children, we can use laser. Laser is a kind of acupuncture that gives the same effect. I show you. For the like you see, there is a lot of studies that show that the effect of laser acupuncture is same effect of the needles. Same effect. You see here, this is a laser. We can put it on the acupuncture points for the babies because it's not painful. That is very effective to do the effect of acupuncture. Before, what is our protocol? Protocol is to do for the cancer, testicular cancer. Before chemotherapy, we do it 48 hours before and immediately after in order to support immunity and to avoid the side effects. Before surgery, we do it one acupuncture session per week. And for the prostate cancer and colorectal cancer. But see, there is another side effect of acupuncture, of the chemotherapy, sorry. The problem is the hand-foot syndrome. Hand-foot syndrome, there is some irritation of the palm and the foot that gives some pain, very painful. With acupuncture, we can avoid it before the chemotherapy. So it's very important. We can use it with acupuncture. For the colorectal cancer, there is a Taxol. Taxol is a kind of chemotherapy that gives this kind of hand-foot syndrome. And for the loss of hairs, we can avoid, not avoiding, but keeping less loss of hairs with acupuncture. There is some treatment with acupuncture to avoid the redness of the skin after radiotherapy. That is very effective. For the larynx cancer, acupuncture is effective to avoid this kind of. But also, we have a lot of protocol to avoid fatigue, to have defensive breaths, we name it Veitsi, but also for the moral we use some points on the back, bladder, the bladder 20, is here, bladder 20, bladder 23, foot here, liver, is liver 13, spleen 6 here, and spleen 3 to tonify the spleen and the kidney, to have a joy of life and to have good energy balance. But what is the main of the acupuncture is to have best immunity, better taste and perception of the flavor, to avoid nausea, vomiting and stomach pain, but also in auriculotherapy we use some points to avoid this side effect, but also to have better appetite and to avoid the nightmare, because it's very we see this kind of side effect with the person, but also hair loss and eyebrows and LH and distancing from the disease. In conclusion, we can say that TCM has a very important role in treatment of cancer by neutralization most of side effects, maintaining immunity, preventing chemotherapy and side effects. But the problem for the oncology is to help them to allow the full dose of chemotherapy to be administered continuously without delay, to have the effectiveness of treatment and to maintain the patient's quality of life. In conclusion, we can say that integrative oncology in patient-centered field of cancer care with mental and physical practice, natural products, and the lifestyle changes from different traditions alongside conventional treatment optimize health and quality of life. But for our current disability is that oncologists frequent ignorance of the effectiveness of acupuncture, but also the under-evaluating of our results and the need for more and more doctor acupuncturists. Thank you for watching.
Thank you so much.
It's a really pleasure to do a presentation for you from Tanzania.
Yeah, so here in Morocco.
Yes,
accepting
you are welcome. Yes, it's a pleasure to show you. I present you to my followers. I'm very happy to have you with us as a guest.
So
what's
your experience here in Morocco?
6 years. From
Yes.
6 in 2019.
And the patient,
I do
how do they accept acupuncture and Morocco?
Yes, they accept. Because when we have pain and we need everything, even we have already practiced some drugs and medical occidental medicine without results. We try to have a better result, so we can. Even I am anesthesiologist. I have the credibility, so they come and there is a result because the result is more important.
Yes, so you
When
are
we
into the
not to
cancer
have
centers?
pain.
Do you work with the cancer centers or you have a private setup?
Private. I worked by public hospital.